Building participation in workplace health and safety. Study in Australia with Diversity Education Training College. Find us on the web, www.diversityed.net, or email us at study@diversityeducationcollege.com.au. To manage risk and workplace health and safety, staff need to identify potential hazards. Hazards can be anything that has the potential to cause harm. This could be noise, electricity, manual handling, extremes of temperature, radiation, hazardous substances, work-related stress, biological or vibration hazards, as well as poor work designs and inappropriate practices and procedures. Hazards can be identified by observing the workplace to determine what may affect the health and safety of people. Hazards can also be identified by consulting people as to their assessments of the safety of equipment, substances, or practices. It's important that regular audits or workplace inspections occur and that a review of injury records occurs. Asking team members what they find difficult is also good practice towards identifying workplace hazards. In order to control risks, staff are required to regularly spot hazards, analyse, evaluate, control and monitor risks, and after making changes, review how it's working. Risk management must occur when any changes are made to the work processes, equipment, or any chemicals used. If a client's behaviour or capacity changes, or if the individual worker's circumstances also change, for example, their health. Risk must be considered when making decisions about which services are to be provided for a client before setting up a work area, and also if you're working in a client's home. When planning work and work processes, it's important that you identify hazards early. After a hazard has been identified, staff should complete an assessment of the probability that the risk presents. So, how likely is it that this risk will cause illness or injury? And how serious would the consequences actually be? Where a risk is identified, controls must be put in place to eliminate or reduce the risk. These can be a range of initiatives, for example, completely removing the hazard, or substituting the hazard for something safer, isolating the hazard from people, or putting other controls in place, reducing the exposure to the hazard, administrative actions, or wearing personal protective equipment. Examples of how risks can be controlled will vary across the workplace, but they could include things such as installing a ramp, using a hoist for lifting, job rotations, or the provision of trolleys for moving equipment. Before commencing any task in the workplace, often what will happen is there's a pre-start or pre-work check, and that will vary depending on the workplace, whether you're working in a home environment, an office environment, or an outdoor environment such as a childcare centre or school setting. This check includes following the organisation's policies and procedures or work instructions, often provided in a checklist, pertaining to the task that you're completing. A pre-work check helps you to manage hazards. This will involve spotting hazards, assessing the risk, and making any changes. Questions should be asked and answered, such as, who is at risk? What is the hazard? What risks can be managed within the workplace, and what risks are not able to be managed? Why will those risks take place, and how will the risk impact on employees and people in the workplace? Some example of pre-work checks are as follows. The equipment must fit the task it's being used for. Floors need to be even, slip resistant, spills cleaned up, appropriate procedures in place to ensure that floors are cleaned, non-slip mats are used, signage in wet areas to warn people of slippery floors, barriers to prevent access, or ensuring that people wear appropriate footwear and clothing. Within a kitchen setting, you might be looking at checking the fridge temperature to ensure that food is being kept at the recommended temperature to control for bacteria. Chemicals should be stored safely and also have the relevant safety information with them. Electrical hazards need to be checked, including lighting, plug sockets and machinery. And clients can also be assessed for risk. checking their general state of health and well-being as well. Personal protective equipment is part of risk management. It's worn by a person to provide protection from physical, chemical, ergonomic, radiation, psychological, and biological hazards. In order to use PPE correctly, PPE is the short term for personal protective equipment, staff need to consider the type of exposure that's likely within the workplace. PPE should be put on before any work activity is started where it is required and removed carefully after the task completion. In the case of things such as gloves and masks that are disposable, they need to be disposed of in appropriate bins and hands washed afterwards. To remove PPE, it's important that staff also follow the correct procedures so that contamination and clean areas don't become crossed. Examples of PPE that you'll find in the workplace can be aprons, gowns, masks, eye protection, head protection, and gloves. It can also include making sure that within the workplace you wear closed-in and appropriate footwear. In this section, we're going to have a look a little bit more closely at basic precautions in health and the use of different types of PPE examples. Hand washing and glove use is one of the most common basic precautions that you will have within the health system, and we're just going to cover that briefly here. So first thing you need to do, I'm just going to share with you some of my favourite links here, and we're going to have a look at putting on a pair of gloves. It's important that you do get gloves that are the correct size and fit and appropriate for the task. You need to take the glove and make sure that your fingers are all in the correct place. It's really important that you put the glove carefully onto your hand without ripping it as well. Make sure that your fingers fill the fingers of the glove comfortably and correctly, pushing down between your fingers to get a really good fit so the glove's not going to fall off while you're doing your work task. And you repeat the process for the other hand. Again, making sure you've got a good fit, there's no holes in your glove, and you're ready to work. The other part of wearing gloves is making sure that you dispose of them and take them off properly. There is a technique to proper glove removal, and it's important that you follow these steps to prevent the spread of pathogens. So you hold the glove at the wrist, touch only the outside of the glove, roll it up into a ball, then you slide an ungloved finger just inside the other glove and touch only the inside of the glove with your ungloved finger. You peel the second glove off then, inside out, and you trap it in your palm. Then you can discard the balled up gloves in the proper disposal. Then you need to clean your hands with soap and water or an alcohol-based cleaner. So how you wash your hands is also really important. There's lots of resources and lots of things you can have a look at about how to wash your hands, and the basic technique is really quite easy. From children right through to adults, it's really important that you follow. You start with washing palm to palm, and between each finger you do the back of your hands, then you need to clean the base of your thumbs one by one, and the back of your fingers. It's important not to forget your fingernails. You've got to get the details of clean hands. Then you move on to your wrists and rub them with the soap and water. Then you rinse the soap away, you dry your hands with a disposable towel, and that's really the basics of washing your hands. In your workplace, you might find there are signs to remind you it is important that you spend at least 30 to 60 seconds washing your hands, but refer to your own workplace's procedures for what they may require. It's also a requirement that all incidents and injuries are reported, especially those involving illness, injury, or property damage. Hazards can be reported verbally or written down depending on the severity. They can be reported face-to-face in emails, on your workplace intranet or phone messages, and also in incident report forms. You need to familiarise yourself with incident report forms, and it's important that when you are filling out all the sections that you don't leave any out and you've put full as much detail as you can in the incident report form. Incident report forms will vary in their format across organisations, but they will always include what happened, how it happened, when it happened, and who was involved, as well as the severity. You need to report the incident to your supervisor and usually the manager as well within 24 hours. There may be some mandatory reporting to government departments depending on the severity of the injury and what's been involved. So you need to know what the lines of communication are across the organisation. So when you're reporting incidents, there may be formal communication and informal communication. It's really important that you understand that informal communication of an incident is not usually adequate. You need to formally write and report the incident. So let's move on to another concept of workplace housekeeping. Effective housekeeping can eliminate many workplace hazards and support an effective workplace. It includes ongoing organisation of the workplace, maintaining halls and floors from hazards, removing waste materials and fire hazards, and making sure there's adequate storage. A good housekeeping program plans and manages storage from beginning of work to the end of work. It ensures minimal handling of objects and ensures adequate disposal and organisation of work areas. Responsibilities should include a shift plan as well as a daily cleaning and inspection of your workplace, regardless of where you work. Daily shift activities can include simple things like removing dust and dirt using a vacuum cleaner, a brush or a spray and wipe cloth for wiping services, as well as more specific procedures for kitchen and washroom facilities. Chemicals used should have what they call MSDS form, which is a piece of paper that explains the hazards associated with those chemicals in the workplace and how to use them. So material safety data sheet is what you need to become familiar with within the workplace for any chemical that you are using. Again, using the personal protective equipment that's supplied within the workplace and making sure the electrical appliances that you have are pre-checked and tested before you use them. So in this, what we're looking at here is a couple of examples of poor workplace housekeeping that audits had picked up. For example, in an outdoor area, storage of equipment hasn't been adequate, work things haven't been put away, and that poses a hazard to a whole range of people in public as well as the workers. And this is an example of a poor housekeeping within an office situation. You can see that equipment has been positioned very precariously, so it can fall and injure somebody. And there's a range of cords all over the floor and everywhere to plug in electrical equipment. So it's really important that these kind of things are not ignored. They're identified as hazards and they're resolved. And it can include maybe you need a different workplace layout or additional PowerPoints to be installed, but it's certainly not something that as an employee you should leave. Another area of workplace housekeeping is how you store your cleaning equipment or your chemicals. So this is an example of poor workplace housekeeping where everything has basically been thrown into the cupboard on the floor, mixed around. It's at low heights, low storage heights. There's not inadequate shelving in there, and it would be quite difficult to get out. There's a step ladder here and those particular things. So there's a number of things in this example that you could do. For example, getting a shelf installed, getting mop hangers so that brooms and mops can be hung up correctly, and ensuring that waste disposals or bins are not kept in closed cupboards, such as this case, which could also be a bacterial risk. So it's the responsibility of workers in the workplace to participate in and develop a culture of workplace health and safety. So that all leads to improving standards. By knowing the procedures, policies and expectations of the company, workers participate in this by actively participating in induction, training, incident, risk and hazard assessment and being involved so that they have some understand that you have a responsibility within the workplace to identify hazards, but also implement risk controls and maintain your equipment, managing waste, using safety equipment, and it's your workers' responsibility to follow policies and procedures, not to cut corners and to take care in their work. It's important that workers not only read procedures, but actually know and understand what's expected of them and practice any workplace health and safety or emergency procedures regularly. For example, you should know what the fire evacuation plan for your workplace is, a procedure for chemical or blood spills, natural disasters, or even physical assault and injury, which is an occupational violence risk in some workplaces. It's important to work as a team, communicate and express new ideas, be cooperative and flexible. Workers need to also reflect on their own as well as others' practices in a positive environment. So consider the individual and special needs of others, encouraging safety and appropriate behaviour in others, and also exercising your rights and responsibilities as a worker. This can be done with discussion and provision of feedback at team meetings, health and safety meetings, management meetings, or during workplace inspections. So we'll have a look at a couple of other examples of where improvements could happen for workplace health and safety. So in this particular example, you can see that there's a hoist which is designed for lifting, and that piece of equipment is not being stored correctly, so it will be very difficult for people to access it. So you need to organise a different storage place for the lifting equipment. It's cluttered, so it needs to be decluttered, and you can see here that there's not adequate storage. So there are bag hooks, but bags are being just thrown on top of this is a plinth for assisting with personal care of the client. So that would be very difficult for the staff to use the manual handling equipment that has been provided because they've used it as a general storage area for sheets and pillows and bags and a whole heap of other things there. So in this workplace, the employees are not using the personal protective equipment that has been provided by their employer, and they need to take more responsibility for their work environment and using the equipment that has been provided. And so you need to reorganise that workplace, reorganise the workplace layout so that bags and other equipment can be stored appropriately and you can easily access the lifting equipment that has been provided. In this other example, this is an example of poor workplace health and safety or housekeeping in terms of storage. So the first aid kit has obviously been utilised and used, and it's not being returned to its proper place by workers, and the checks of it to ensure that it's easy to access in an emergency for first aid requirements. So again, having regular checks on your first aid kit that if they contain the correct contents for what your workplace needs, but also that things are returned appropriately to any storage areas for the next employee. So you don't have to search through things as you would in this case if you're trying to if you require a first aid kit. So in what ways could you raise workplace health and safety issues with your designated personnel or your supervisors? You need to also always follow your organisational procedures. The best way to raise workplace health and safety issues is usually by reporting within an understanding of your lines of communication, who your supervisor is, who your manager is. It could also be by using a feedback form, a maintenance report, or direct communication between management and staff at a management meeting or in workplace inspections. You can provide input. How do you do this? But you can provide input to improve workplace work systems and processes according to your organisation's procedures, as well as reporting hazards to designated people and following workplace health and safety policies and procedures. You can actively be involved in improving workplace health and safety procedures and standards by attending regular training and meetings in your workplace. Attend the health and safety committee meetings to discuss and report on any issues or hazards. They may be also called team meetings or in-service meetings, or they may be separately called health and safety meetings. It depends on the organisation. Staff can gain valuable feedback, and from these sessions, our policies can be reviewed as a result, which quickly can address any issues in the workplace. Workplace meetings are conducted to discuss issues and identify hazards, problem solve how to fix the issue, implement solutions, and then follow up. Check that the solution is actually working. Consultation with employees and workplace meetings is a legal requirement and an essential part of managing risk. It helps everyone to openly communicate, to identify risk, talk about health and safety concerns, and find solutions by drawing on workers' knowledge. As workers are involved in the process, it helps to increase your awareness and commitment, as well as positive relationships between all workers. Consultation helps each staff member understand how the activities may impact on health and safety and the actions they need to take to control risks. Consultations can be an excellent forum to suggest ideas for your workplace improvement. Emergency situations and emergency events are also a key part of how you manage workplace health and safety processes. Emergency plans in workplaces usually detail the list of potential emergency situations, and there'll be a set of instructions of what you should do in the event of each emergency. Staff are under a duty to familiarise yourself with possible emergency situations in your workplace and how your company or your workplace deals with them. So you need to look at any emergency plan for fire evacuation and understand what you need to do. When staff have identified an emergency situation exists, you need to follow your organisation's procedures, and they usually include reporting it by raising alarms, activating emergency alarms, and calling emergency services. Later, when you're in a safe environment, the incident needs to be reported using a correct incident reporting procedure and management informed. How do you know then? How would you follow the organisation's procedures for responding to emergencies? It's usually in what's called an emergency plan. An emergency plan can be a written document, can be a simple poster on the wall, or it can also be covered in induction training. Emergency plans detail what to do in the event of an emergency, including emergency procedures, effective responses, notifying emergency services, medical treatment, and effective communication. Plans consider the nature of the type of work, hazards, and how many people involved. It could be a map, a set of instructions for you to follow, or a more comprehensive plan. Emergency plans should be readily accessible and workers trained in them. Training must include the practice of evacuation, identifying assembly points in the workplace, location of important equipment, and also how to shut down equipment safely if required. In the event of an evacuation, alarms are raised, emergency services called, and everybody calmly leaves the building immediately. Usually there will be a fire warden that will facilitate this, and you assemble in an emergency assembly point. So again, I'd like to share with you a nice little link that you can find on how to use portable fire extinguishers. It's important that you familiarise yourself with these kind of things. Small office fires, small kitchen fires can easily be managed and resolved with the appropriate use of fire extinguishers. So in this little video, let's have a quick review on the use of a fire extinguisher. So before you use it, you need to notify the fire department, make sure others are alerted, and the evacuation has begun. When you're going to use a fire extinguisher, make sure you've got a clear escape route, the extinguisher that you're familiar with it, and you know how to operate it. You need to make sure that the fire extinguisher that you use is appropriate for the type of fire. There's common types of fires that are classified. Class A for wood, paper and tyres. Class B usually involve gasoline or petrol. Class C, appliances or electrical fire, like televisions, office equipment. And Class K, cooking oils, a kitchen fire, for example. Now they talk about the power system. P, pull the pin. Stand about 8 to 10 feet from the fire, don't get too close, and aim the nozzle at the base of the fire. Once it's aimed at the base of the fire, squeeze the levers. You keep your distance from the fire and you move the nozzle side to side. You discharge the extinguisher till all the contents have been extinguished. So quick actions can save lives and protect property, and it's important that you familiarise yourself with how to use a fire extinguisher. As again, you can find a range of just demonstration videos and links like that on the internet, or your workplace might have some more specific training for you to complete. So now we're going to have a look at a couple of practical examples and go through scenarios as though we're doing a workplace inspection. So regular workplace inspections are conducted to check possible hazards of equipment and processes. They check whether agreed workplace inspection checklists and tasks are being completed and health and safety measures are being enforced and followed. They're necessary to keep the standard of work to an optimum and safe standard. They protect staff and clients from risks. So it's really important that we understand how a workplace inspection works and how you identify hazards. So let's go and have a look at a couple of practical examples here. In this example, we're in an outdoor area, it could be a play area, and you can see some of the things that might be a hazard. You might have animal hazards or insects and spiders, those kind of things. If you've got children playing in the yard. You've got rocks, which could be a tripping hazard here. And this area here also could be a tripping hazard here for people to be alert and aware to. There's a falls hazard from swings, and you see that there's a range of soft fall. Yeah, it depends what soft fall is. In this case, they're using soft pine bark, it looks like, and you'd have to ensure that that was of an adequate depth and there was enough of it in the event somebody fell from the swing. A couple of other hazards you can see here. There's a sand pit. And sand pits pose different hazards that are important, and that's kept clean and covered. It doesn't appear to have been covered, and so it covers it from animals that might use the sand pit inappropriately, and also usually where there are sand pits in childcare centres, needs to be checked for any contaminants and raked over before use. So when you're looking at what there is, you need to look at environmental hazards and any other safety hazards, making sure that fences are secure, gates are able to be closed, there's the sunshades are adequate for sun protection in that particular area as well. So have a look at that and you can make some notes yourself around what kind of hazards, or think about what hazards you might find within an outdoor setting, park, or a childcare play area. In the workplace kitchen, there's a range of hazards that may present themselves to staff. So you've got electrical equipment and hazards associated with hot foods or hot items, and ensuring that you've got clear workspaces, trolleys to move for removing items, so ensuring that they're adequate, the wheels move smoothly, and that your fire equipment in here, you can see there's fire extinguishers, is clearly labelled. They've got a washing procedure, there's an emergency procedure, emergency plan on the wall, and you can see that within this kitchen environment a range of different hazards that may be there, and the risks are being managed through a range of educational material that's available, providing safety equipment. There's soap for washing hands, and storage of items up high in this particular situation. Office hazards. So if we have a look at this scenario, this is an example of an office area, and you can see quite clearly there's a range of things that could be improved. The hazards that we have here associated with poor storage and clutter. Things are stored on the floor that might need to be lifted. You've got tripping and electrical hazards because of the layout of the cords, and in the reception area, you also need to look at your ergonomics of that. If you're sitting in your chair, are the chairs suitable? There's 2 chairs in a very small confined workplace, so you might want to have a look at the work layout and how things can be decluttered, neat and tidy and easily stored, so that it's a safer work environment here. By getting more storage and clearing up mess is really important too when you're looking at your office workplace health and safety requirements. So participating in workplace health and safety is an essential skill for all workers. You need to identify hazards, don't ignore them. You need to assess risks, identify solutions or controls, and implement solutions within your workplace. Communicate and work as a team. Participate in your workplace health and safety and team meetings. If you see a broken item, don't leave it. If you see things left all over the floor and not tidy and put away, such as the hose in this example, pick them up. And be aware of what your emergency plans are for your work environment and how to use any personal protective equipment or safety equipment that has been provided for you. Thank you for watching. This lecture has been provided by Diversity Education College, Health Science and www.diversityed.net, or email us at study@diversityeducationcollege.com.au.